A 6-month-old baby caught measles while being carried through a restaurant lobby. The infected person left 2 hours earlier. The baby never saw them, the mom never touched anything, and her baby still got sick. That's how contagious measles is. I'm Dr. Zaid Fadul, and in the next 10 minutes, I'm going to show you exactly how to protect your family during the measles outbreak. 3 people died from measles in 2025, the first deaths in over a decade. Cases are accelerating nationwide, and most people don't realize how serious this is until it's too late. Let's dive in. Measles is not a mild illness. It attacks your entire body and can cause serious, sometimes permanent damage. Here's what you need to understand first. There is no treatment for measles, no antiviral medication, no cure. Once you're infected, doctors can only provide supportive care, fluids, fever management, oxygen if needed, and hope complications don't develop. That's why it was such an achievement when we eradicated it 25 years ago. Measles is the most contagious disease on Earth. Each infected person spreads it to 12 to 18 unvaccinated people. The flu spreads to 1 or 2. Measles is in a completely different category. When you get measles, it starts like the flu. Fever above 104, severe cough, runny nose, and inflamed eyes. For most people, this alone means hospitalization or bed rest for days or weeks. But then comes the real danger, complications. About 1 in 10 people with measles are hospitalized. For children under 5, more than half require hospitalization in major outbreaks. The 4 most serious complications? Pneumonia occurs in about 5% of cases. The virus infects lung tissue, fluid fills the lungs, and breathing becomes difficult. This is the leading cause of measles death. Brain inflammation, or encephalitis, which occurs once in 1,000 cases. It causes high fever, severe headaches, seizures, and sometimes permanent brain damage or deafness. Ear infections occur in about 10% of cases and can cause permanent hearing loss. And subacute sclerosing panencephalitis, or SSPE, is rare but devastating. A degenerative brain disease that develops 7 to 10 years after infection, causing progressive dementia and death. There is no treatment. Death occurs in 1 to 3 out of every 1,000 people with measles. So far, the South Carolina outbreak that affected almost 900 kids, 1 is likely to pass away. In 2025, 3 people died from measles in the US, 2 children alone in Texas. Pregnant women face catastrophic risks: miscarriage, stillbirth, preterm birth, severe pneumonia, and hospitalization. That's why vaccination is absolutely critical. It's the only tool we have to prevent this. Let me explain how the MMR vaccine works and what you should be doing during an outbreak. The MMR shot gives your immune system a practice run. It uses a weakened form of the virus so your body builds antibodies and remembers measles. Later, if the real virus shows up, your immune system recognizes it and shuts it down fast. 1 dose protects about 93% of people. 2 doses protects 97%. That second dose isn't a bonus, it's what gets almost everyone to solid long-term protection. It also rescues the 7% who didn't respond to the first shot. Kids usually get their first dose after their first birthday and the second dose between ages 4 and 6, before kindergarten. But here's what most people don't know. We only started giving 2 doses in 1989. If you're over 35 years old, chances are you've only got 1 dose. I strongly recommend working with your doctor to get a second dose. If you've had measles once in your lifetime, you have immunity for life. You don't need the vaccine. Side effects are usually mild, sore arm, low fever. Serious reactions are extremely rare, about 1 in a million doses. Now let's address the elephant in the room, the autism myth. That study was fraudulent. The doctor falsified data because he was paid $700,000 by lawyers trying to win a lawsuit. He lost his medical license. Dozens of large studies confirm there's 0 connection between MMR and autism. Now, if you don't know your vaccination status or can't find records, you have 2 options. Option 1, get a blood test for measles antibodies. Results come back in 3 to 5 days. If negative, get vaccinated. My practice, Bespoke Concierge MD, is available in all 50 states if you need help with testing. Option 2, skip the test and get vaccinated directly. Even if you're already immune, another dose is completely safe. During outbreaks, this is usually faster. For children ages 1 to 4 with only 1 dose, get the second dose immediately. Don't wait until kindergarten. That extra 4% protection could be the difference between staying healthy and being hospitalized. For infants 6 to 11 months in outbreak areas, an early dose is recommended, but it doesn't count towards the regular series. They'll still need 2 full doses after their first birth date, at least a month apart. If you've been exposed to measles, you have 72 hours to act. This window can prevent infection entirely. Get the MMR vaccine immediately. When given within 72 hours, it can stop disease completely or dramatically reduce severity. You may not even need to quarantine. If you're pregnant, under 6 months old, or severely immunocompromised, you can't get MMR because it contains live virus. You need immune globulin, concentrated antibodies, within 6 days of exposure. Critical rule, never get the vaccine and immune globulin at the same time. IG cancels out the vaccine. If you get IG, wait 6 to 8 months before getting MMR. If you miss both windows and aren't immune, quarantine for 21 days. If you got IG, extend that to 28 days. After exposure, there's a 7 to 14 day incubation period where you feel completely normal while the virus multiplies. Then symptoms hit. High fever above 104, severe cough, runny nose, and red eyes. Most people think it's the flu. 2 to 3 days later, tiny white spots with red halos appear inside your mouth. These are Koplik spots, and they only happen in measles. Days 3 to 5, the rash appears at your hairline and spreads down to your neck, chest, arms, and legs. Critical point, you're contagious from 4 days before the rash until 4 days after. That 8-day window is why it spreads so fast. You infect people before knowing you're sick. If you develop symptoms, isolate immediately and call your doctor before visiting the clinic. When I was in residency, we had a patient with confirmed measles show up at a local clinic without calling ahead. It shut them down for a week and disrupted care for hundreds of patients. That's why virtual urgent care, like what we offer at Bespoke Concierge MD, is ideal for diagnosing measles. If sick patients aren't sitting in a waiting room for 2 hours, measles never gets a chance to spread. And that brings me to how the virus actually spreads. Measles spread through tiny airborne particles that remain infectious for up to 2 hours after an infected person leaves a room. You can catch measles by walking into a room where someone was 2 hours earlier without ever seeing them or touching anything. In Colorado, one 11-hour flight infected passengers sitting 5 rows away from the sick person. Ventilation matters dramatically. In poorly ventilated spaces, transmission rates reach 87%. In well-ventilated areas, it drops to 17%. But even 17% is extraordinarily high. Bottom line, avoid crowded indoor spaces if you're not immune. Waiting rooms, concerts, shopping malls, restaurants during peak hours. If you can't get vaccinated or choose to remain unvaccinated, you're not doomed to hide away. Here's how to reduce your risk. Wear an N95 respirator in high-risk settings. Surgical masks offer limited protection against airborne particles. N95s filter 95% of those particles. Ensure proper fit, it needs to seal tightly around your face. A beard like mine will mess up the seal. Wash your hands rigorously. Soap and water for 20 to 30 seconds after being in public and before touching your face. Virus particles can land on surfaces and remain infectious for hours. Hand-to-face contact can transmit infection. Disinfect high-touch surfaces daily. Doorknobs, light switches, phones, countertops. Use EPA-registered disinfectants like Clorox or Lysol wipes. Improve ventilation. Open windows when possible. Use HEPA air purifiers to filter airborne particles. You can check out my review on those to find the right one linked above. If you develop symptoms, wear an N95 mask, isolate immediately, and call your doctor before visiting any clinic or hospital. Now, some people can't get vaccinated at all. Let's talk about protecting them. Infants under 12 months can't get the vaccine until their first birthday. Use cocooning. This means you make sure everyone who touches the baby has 2 MMR doses. Parents, siblings, grandparents, babysitters. Avoid crowded indoor spaces with infants. If exposed, they can receive immune globulin within 6 days. Pregnant women face dramatically higher risks. Hospitalization, severe pneumonia, miscarriage, stillbirth, and preterm birth. If you're planning pregnancy, verify your immunity now and get vaccinated at least 1 month before conceiving. You cannot get MMR while pregnant because it contains live virus. If you're pregnant and get exposed, you can receive immune globulin within 6 days. Immunocompromised individuals, those with HIV, cancer, or on immunosuppressant drugs, face the highest mortality risk. They often can't receive MMR. Best protection is strict cocooning. Vaccinate everyone in the household. Avoid crowds entirely. If exposed, they need immune globulin immediately and close medical monitoring. Now, if you have measles, isolate for 4 days before rash onset through 4 days after. It's about 8 days total. The problem is you don't know exactly when those 4 days start. That's why we suggest you isolate immediately. The 21 days would cover the 14 days it would take symptoms to start showing up and the 4 days for the rash to begin. If you're exposed but not immune, quarantine for 21 days after last exposure. If you got immune globulin, extend that to 28 days. If you got vaccinated within 72 hours of exposure, you usually don't need to quarantine. But check local health department rules. They vary by state. You're immune if you have written proof of 2 MMR doses at least 28 days apart, or a positive measles IgG antibody test, or lab-confirmed previous infection. Sometimes people think they have the measles and it turned out to be something else. That's what happens. They're not getting measles twice. During outbreaks, getting vaccinated is usually faster and more practical than just waiting for test results. Here's what you need to do. 1, verify your vaccination status today. 2 documented doses means you're protected. 2, if you have only 1 dose, get the second immediately. 3, if exposed, get the MMR vaccine within 72 hours or immune globulin within 6 days. 4, use layered protection. Avoid crowds, wear N95s, wash your hands, disinfect surfaces, and improve ventilation. 5, protect vulnerable family members. Vaccinate everyone around infants. Verify immunity before pregnancy. Use strict isolation for immunocompromised people. And 6, know the symptoms. Isolate immediately and call ahead before visiting any clinic. 7, follow quarantine rules. 8 days if you have measles, 21 days if exposed and not immune. This outbreak is serious, but it's preventable. 2 doses of MMR vaccine provide 97% protection. Now, if you want personalized guidance on vaccination, immunity testing, or protecting your family, we're here to help. At Bespoke Concierge MD, we offer measles immunity testing nationwide with results in 3 to 5 days, virtual consultations for measles exposure, and personalized protection plans. Visit BespokeConciergeMD.com or click the link below. If you want to know how measles became a thing again, the video on the right is a breakdown of how measles came back. The playlist on the left covers measles and related issues in detail. Have you verified your MMR immunity status? Comment yes or no. Thanks for watching. Stay safe. I'll see you in the next one.